webinar, and it's presented by our very own Diana Fellner, who is the VP of Public Policy here at the Tourette Association of America. Diana does a great job with us by providing direction and ensures that the implementation of all the TAA public policy is implemented. She's got over 20 years of experience and knows everybody in government. So without further ado, I'm going to hand it over to Diana, and she'll take it from here.
Perfect. Thanks, Joe. I appreciate the fabulous introduction. And I also want to thank those of you who have called in today so that I appreciate your taking time to learn more about what we do here in public policy and how we can work together, both me in Washington and all of you in the States. So with that, let's go to our next slide. And I wanted to give you guys an overview of sort of what our strategic plan is in the public policy area. So in public policy, one of the top line strategic items is focus and increase programmatic impact and delivery. One of those big strategic overarching bullet points that sounds fabulous in a strategic document. But what does that really mean? So what that really means is our top priorities are to support $2 million in continued funding for the labor HHS appropriations for the CDC Tourette Syndrome program. And I know Chuck is very familiar with that, being in Washington, along with some of the others who were in town for Advocacy Day this last year. In addition, we want continued federal funding for medical research at the National Institutes of Health. We want to increase coverage for telehealth and Medicare and private insurance for those with chronic conditions. Support efforts to ensure patients have access to all treatments without onerous processes, steps, or excessive out-of-pocket deductible costs. And finally, we want to monitor and engage as appropriate on issues such as healthcare reform, mental health parity, education, and disability issues. All right, let's go to the next slide. So another overarching strategy is to invest in our people. And along those lines, we actually have created a MAB or SAB advocacy group, or Medical Advisory Board, Scientific Advisory Board advocacy group. So we are working directly with the doctors and researchers who are on TAA's MAB SAB to ensure that they understand what we're doing in the public policy realm for TAA, and also to make sure that any of the things that we're working on in Washington also help our doctors, because we need to make sure that those who are taking care of the TS patients, any policy we're supporting positively impacts them and doesn't negatively impact them, or can actually help them to ensure that our folks continue to have access to care with these amazing experts. In addition, we tried to engage the state chapters, such as yourselves, with summer meetings with members of Congress and senators. So you should have all received an email from Joe, which gave an outline on how to request meetings with senators and members of Congress over the summer recess while they're home. And this is important for a few reasons. One, it's great to get to know the folks in Washington, and I do, but it's always even better when they get to meet their constituents. And when you meet in the district or state, you get to know the staff not in Washington, but actually back home in the state and district, so they too get educated on Tourette syndrome and tic disorders and why it is so important for them to understand that and think of those things for their boss. But also, members of Congress and senators remember those meetings at home sometimes a little more than they do the ones in DC, since there's not as many of them there in district or in state. And then finally, we're having the webinar today on public policy, and I'm sure we'll have more over time, particularly after the elections and we understand what the results are earlier in 2019 once committee assignments start to get known. All right, let's go to the next slide. And our next overarching and final overarching strategic priority is fostering connections to bolster organizational awareness. With this, we're doing a few different things. I know you guys have noticed in the last 2 years that we've done things a little bit differently, and one is continuing to develop and send grassroots opportunities for state chapters and support groups. Traditionally, we had always done the emails of go to this link, type in your address, and it will automatically send letters to the member of Congress and senator. And we still do that, and that is a good thing to do. And it is definitely something we should do. But we've taken things a little further and a little more directly strategically. And with that, those are the appropriations outreach emails that you may recall seeing, where we've asked you to take some draft text, put it into an email yourself, add your personal story to it to personalize it and individualize it so it's memorable for that staff person to understand why it's so personally impactful for you. And then instead of sending it to just the general mailbox of the congressman or senator, we're actually giving you specific staff to send it to. And the reason is we are assured with these emails that staff person is going to get it and see it, and that is who is responsible for making decisions on funding or policy for the congressmen or senators. So far we've used this just for appropriations. However, if we get to points of key policy or key things that need to be managed, we will be using it for those as well. And I want to assure you that your time is well spent. And the reason I say that is one of the key appropriations staff in the Senate last fall said, Diana, I want to say great job on your campaign. And at first I said, what campaign? And he said, I got a lot of emails. He's like, in fact, almost an annoying amount of emails. Good job. Keep it up and make sure you're getting them to other senators as well. And you're getting them to both sides of the aisle. So these emails do make a difference. The staff are reading them and they do notice it. So yes, we're doing things a little bit differently, but there's a reason why. There's definite impact. The other part of this grassroots opportunity is those summer recess meetings that I sent out to you guys in August. Not sure how many of you did them or how many folks went, but the more we can do those in the state, the better. And not only do we have the opportunity in summer, but we have it when they're home throughout the year. And with elections coming tomorrow and those results being known in most cases tomorrow night, but over the coming weeks for really tight races, that's going to provide opportunities to us. And as those new members start their jobs early in 2019 in January, opportunities to meet these new members, but also in January and February when we learn committee assignments, there might be people in new roles that we need to reintroduce ourselves to, remind them about Tourette syndrome, and or get to know people that do have new assignments. So that is a reason why we're trying to bolster organizational awareness. And then another bullet point that I have taken pretty seriously and since I started 2 years ago, which is continuing to develop and build relationships with key patient groups and other like-minded groups to increase awareness of PAA priorities. And then develop partnership opportunities for projects or funding or just working together at the state or federal level. And I'm making relationships with organizations here in Washington, but the state chapters, you guys have the same ability to do the same thing in the states. So there's opportunities for you to work with the state chapters of these different organizations, or maybe there's groups we don't know about that we should get engaged with, and we can find common ground to work together. But the more we can pool resources, whether it's time, energy, voices, the better. And that's how we're going to be more successful. So with that, I thought I'd dive into a couple of our key priorities I mentioned earlier and give you a little bit more detail and flavor for some of the things that we're working on in them. So with that, let's go to our next slide. So access to care and treatment. This is a top issue for us. And I will say of the phone calls and emails that I get or the conversations I have with those of you in the States, this is the top issue that I'm hearing about that truly impacts our patients' lives on a day-to-day basis. And what this means, access to care or treatment, means the fact that our patients can see doctors when they need to see doctors, they can get the prescriptions that they are prescribed, they can get the treatment or therapies that they need without onerous processes, without excessive costs, and making sure that everything is able to get covered. So to that end, one of the things we've done is we supported HR 2077, which is the Restoring Patients' Voices Act. And unfortunately, we're near the end of Congress and it hasn't passed yet, but I'm sure we'll be back next Congress. And what this bill does is this bill basically says that doctors, the patients, when they go to see their doctor and their doctor writes them a prescription and it's for drug X, and they go to the pharmacy and the pharmacy says, oh man, yeah, your insurance doesn't cover drug X. You need to try drug Y instead. And you're going to need to try that for a while and see if that can work. So this bill seeks to address that. That's called step therapy. That is when, despite what your doctor has prescribed, your medical prescription benefit manager believes you should try something differently for a variety of reasons. And that is a huge issue that we face. And several of our doctors have expressed concern about that, because the doctors don't even always know the drug has been substituted and drugs are different. But also for the patients who really want to get that drug that their doctor prescribed. So we are working on this bill with several other patient groups and coalitions that we are a part of. We hope it comes back next year. It should be reintroduced next Congress, and we'll continue to support that due to its importance to our members. Another top priority is that we oppose the administration's proposed changes to the evaluation and management aspects of physician reimbursement for Medicare for 2019. Man, that's a mouthful, right? But the bottom line is that basically the administration for Medicare was saying that physicians had 5 levels of category for complexity of a visit with a patient to categorize for their reimbursement, 1 through 5. And 1 being less time and simple, and 5 being relatively complex. Well, I'm sure you can appreciate that most Tourette patients fall in the level 4 to level 5 complexity categories. They were talking about bringing it down to 2 or 3 categories and not having necessarily the 4 or 5 complexity to really give that reimbursement for the extra time that is needed to take care of those patients. You know, it's not tied necessarily to a treatment per se. And because of that, you know, that could significantly impact Tourette syndrome patients' access to care. Well, the good news is that in the last couple days, the administration released their final rule, and they did go to 3 levels of complexity, which is better than 2, but they kept level 5 complexity. So that still exists. Now we're grappling a little bit with the fact that there's category 1 and then there's 2 to 4. But there is some add-ons that are allowed for extra time, and we believe that is a definitive positive. In addition, they're not actually implementing that for 2 years, so that gives doctors and us time to work with the administration to help develop the policies in a way that least impact our population and, in fact, hopefully benefit our patient population. So we're working closely with other physician groups on this, especially the American Academy of Neurologists and others, in order to make sure that we are in line. We're also working with doctors on our Medical and Scientific Advisory Board and other patient groups in Washington. So this is an important one. Literally would affect the ability of our patients to seek doctor care and get appointments, because they need to manage them, you know, an ability to make money for their institutions as well. So I think we see it so far as a win. We're going to continue to evaluate that, but we're working with the administration and the other groups, and we will continue to do so over the next 2 years as they finalize the actual rule procedures that will go into place. Also, we submitted comments on the president's blueprint for drug costs. So he had asked for ways and thoughts on how he can reduce drug costs across the board. So not only were we a part of the comments submitted by many of the coalitions that we are a part of, we also submitted our own comments on what is important to patients with Tourette syndrome, including things like no step therapy or fail first, which I mentioned previously. Also making sure that there's access to generic medications, not just brand names necessarily, and that new drugs can get put on the market, since we do have several that are currently in clinical trials now, and we're very excited about that. And then finally, this became apparent in the blueprint, which is continuation of protected status for antipsychotic, antidepressant drugs, and other drugs under Medicare 6 protected class policy. The administration wanted to change Medicare Part D, which is where you get your pharmaceutical drugs that you take outside of a doctor's office. They wanted to actually change that to, rather than having to provide all different medications in those categories and make sure they're accessible to everyone under Part D, only having 1 drug per class. So that would mean they would only have to provide 1 antipsychotic and or 1 antidepressant under coverage. As you all know very well, it takes our patients who do take medication time and maybe several medications before they can find that exact right one and that exact right dosage that works best for them. So to suddenly have that not covered or to suddenly have that not be available to them would be not acceptable. So we are working with several groups that we're a part of, and we also just recently joined the Partnerships to Protect Part D Access to work hard and continue to work to protect our ability to have antipsychotics and antidepressants covered across the board for Medicare Part D for those of our patients who are on Medicare. All right, let's go ahead and go to the next slide. So telemedicine, you know, this is a big issue and I think a really big one for our community. And the reason this became such a big issue is we've talked, you know, our doctors talk about telemedicine and how that could be so beneficial across the board in so many ways. But also, you guys know better than anyone how far our patients are having to go to find those right specialists and doctors and get treatments. You know, California's lucky you have a center of excellence there, but it's at UCLA and California is a big state. If you're not in California or Utah and you're in the western portion of the country and you want to go to a center of excellence, you're going to have to travel really far. So telemedicine has been available in some instances within state boundaries. But with Medicare, it was only allowed if you were in a certain facility and your doctor was in a certain facility, versus allowing it to be used more freely, as in the doctor could utilize it from his office, you could be in your home and use it more freely. Some private insurers also have different coverage for telemedicine as well. So because of this, we help support a bill called the Connect for Health Act. And what the Connect for Health Act said was if someone is in Medicare, especially the Medicare Advantage plans, then if they had 2 or more chronic health conditions, telemedicine should be covered for them to manage and work with their doctors and be compensated so that they don't have to travel to and from the office. And they can use that to make things cheaper and to make visits easier for people with those conditions. The fantastic part of that was that in the Budget Control Act, so as they were working on tax reform and therefore the budget items, this actually passed and got written into law, which is great. And the administration was supposed to request comments before the end of the year. The good news is they've shown us that they are moving towards that. They do want to cover it for chronic conditions. They do want to have it where you can utilize it, of course, at this point within state boundaries, mostly because of licensing requirements for doctors. They are increasing the ability to cover the telemedicine, and they are asking for comments by December 31st, 2018. So we look forward to working with our doctors, working with other patient groups and coalitions to develop some fantastic comments to submit, try to get increased coverage. And also, this bigger issue that we're going to continue to have to work on is not just within state lines, but trying to figure out how doctors can work with patients outside of their state lines, since so many of our doctors that are experts in Tourette syndrome have patients that are coming from other states. So that's a work in progress. And to that end, we are going to continue to work with the Health IT Now Coalition. That is a coalition that focuses on all aspects of health IT, whether it is electronic medical records access or telehealth, to try and get the best of the best working as far as technology goes to make it more seamless for patients and also for doctors as they move forward. So we'll continue to work with them as this moves forward. All right, let's go to the next slide. So I know you all are familiar with our spring briefing that we have every year, our children's briefing on Tourette syndrome, which is such a fantastic and wonderful event. It is something that I am very proud of and that I think is truly amazing for the Hill to fully visualize and experience what Tourette syndrome is, how it impacts people in their daily lives, and why they should know and care about it as they do their jobs and look at policy that could impact it. And also the spring briefing gives an overview of what the CDC and their program does for Tourette syndrome and why that is so important to our community. As you know, and as you've seen in press reports, emails, newsletters from TAA, we've had some really fantastic research advances on the science side of things over the last 2 years. And, you know, basically the money from the economic stimulus funding in 2008, things take a while once funding happens in order for results to come. And basically these results that we're seeing are the result of that investment made almost a decade ago. But they've been fantastic. You know, we've had neuroimaging studies that show differences in the structures of brains. We've had genetic advances where we now have genetic constructs that we know are linked to Tourette syndrome, as well as polygenes and other aspects. The list goes on, you know, that we deep brain stimulation, we know that that is beneficial and works with our patients. So last fall, we did the first inaugural briefing to talk about research advances in Tourette syndrome, as well as treatment advances, to better educate those up on the Hill as to what is going on in the world of research for Tourette, what the return of investment is on the funding that they have been providing to NIH and others for Tourette syndrome research, and also for treatments, and therefore why they should continue to invest in that, because, you know, we've had great progress and we want that to continue. So on October 25th, it seems like yesterday, but it's been, you know, a couple weeks now, TAA, in coordination with the Congressional Tourette Syndrome Caucus, we held our second annual congressional briefing on advances in treatment and research for Tourette syndrome and tic disorders, because last year's event was such a success. So what we did is we provided an overview and education of staff, as I mentioned, on these new findings, including CBIT and CDC's role, but also some of the new research I alluded to. So during the briefing, we had presentations from Amanda Talty, our CEO, who talked a bit about Tourette syndrome from the patient point of view, sharing some of the research results from the survey monkey that we did earlier this year. In addition, we had Dr. Keith Kaufman, who many of you know from Children's Mercy Hospital, talking about improving patient access to quality clinical care for Tourette syndrome. Keith gave a bit of an overview on Tourette syndrome, comorbidities, different treatments, and things that are beneficial to patients, as well as a bit of the importance of some of the CDC programming. He was followed by Dr. Scharf from Mass General, who talked about advances in understanding of the genetics underlying Tourette syndrome, and the study results were released in 45 days of the briefing, showing not only do we have 3 constructs now instead of 2 from last year, but that we're also understanding a lot more about smaller polygenes and how groupings of different smaller genes can impact Tourette syndrome. For example, different polygene groupings could indicate that that person would be a good candidate for deep brain stimulation. It could show that person might be a good candidate for CBIT. That they're starting to understand these things a little more. It's very early in, but this polygene concept coupled with these bigger single genes really could change how our patients are treated and get to a place of more personalized medicine approach as time goes on and we have more understanding of the genetics. So quite fascinating. That was followed by Dr. Deeb, who is with the University of Florida, and he gave a presentation on deep brain stimulation as a treatment for Tourette syndrome. Deep brain stimulation is still investigational and not approved, so these are all done in a study form, but he showed video and talked about the benefits for folks who have pretty severe Tourette syndrome and how this sort of pacemaker for the brain can, you know, tremendously improve their symptoms and their quality of life and their ability to work and go to school and other things. So this briefing was really well attended, especially in October, not too far from an election. But we had over 20 congressional staff that attended the meeting, from committee staff to personal office staff, but some quite senior staff as well. So we were very impressed with that. NIH and CDC also sent representatives from their DC offices to come and listen to the briefing, as well as a dozen or more patient and partner organizations who attended the briefing as well. We received great feedback from our caucus co-chairs who thought it was a fantastic event, as well as many of the other patient organizations and staff at the briefing as well. So we look forward to a 3rd annual, hopefully next fall, if we've got some great results to share. And you know, the one unfortunate piece is you can never predict anything in Washington, but unfortunately, right before our briefing, there was an evacuation of one of the House buildings for a suspicious package. It made it interesting in that some staff were a little bit late So we started a tiny bit late, but beyond that, the briefing was fantastic. So with that, I want to switch to the next slide, just to give you a little bit of a visual as to some of the partnerships that we're working on. So I mentioned working with other organizations, patient groups, coalitions. So these are the logos of some of the groups that I've worked with over the last 2 years. And it's a very busy slide. I understand and appreciate that, but just wanting to show you a little bit of the groups. Well, it's a good cross section of the groups that we're working with and why. And as you're looking at these logos, what I hope you're thinking of is, oh, I know my state chapter for March of Dimes, or I know my state chapter for Michael J. Fox Foundation or Fragile X Foundation, because you also have the ability to work with them at the state level with issues in common that we have. And I promise you, with every single one of these groups that I've listed here, we have at least one thing we can work on in common, if not for many of them, many. And I think one that folks always ask about is Men's Health Network, for example. Well, the connection there is that Tourette is more prevalent in men versus women, or boys versus girls. So once I went to one of Men's Health Network briefings on CHIP, the Children's Health Insurance Program, and mentioned this to them, and they were completely unaware of this connection. So now, when it's Tourette Syndrome Awareness Month, they're making sure they're sending something out to their folks. Hey, did you know that this is more prevalent in men versus, girls and women? So a total positive relationship. So we can find these with everyone and anything, but just wanted to share with you a slice of here's some of the folks we're working with and why. And if you have particular relationships with groups in your state, great, let me know. Send me an email, give me a call. Let's talk about it. Maybe we can see, what we're working towards. One of the things we're also trying to do is in some of these coalitions play a leadership role as well as TAA. And to that end, I have been elected to the board of the American Brain Coalition, which is a group of neurologists and patient groups that all care about neurology and the brain. I have also been elected to the board of the Mental Health Liaison Group, which is a group of advocates or lobbyists in Washington who all lobby on mental health issues. And also, was elected to the executive committee of the Friends of the NCB-DDD, and that group that's the National Center for Birth Defects and Developmental Disabilities, which is the division at CDC where our Tourette Syndrome program falls. So working with others who are also funded and care about the work by that agency as well, to try to find common goals and make sure that we can advocate for the appropriate funding for that division as well. All right, so with that, to the next slide. So really quickly, I did want to talk about, lobbying laws, because lobbying laws exist. So they exist for federal, which I'll cover in a minute, but I wanted to make sure everybody is aware that lobbying laws also exist in the states. So each state has its own state laws and regulations for lobbying, their own definition on what lobbying is as well. And some states require registration, some require reporting, some require fees, some require all the above, or a combination of some of those. Understanding what that means and means by state is important to do. And failing to follow lobbying laws can result, depending on the state, in civil or criminal penalties. So this is a long way of saying, if you are contemplating lobbying in your state, or going to have visits with lawmakers at your state level, so your state legislators or state senators, or sometimes, like in New York, for example, even if you're going to meet with those regulators who are going to write the regulations in your state, then it is important for you to contact us while you're in the planning stages of this, so we can look at and see what those laws and regulations are in place before we do anything, because we want to make sure that we are complying and that we are following the rules and the law, because that is in our best interests. So just a reminder, again, make sure before you engage in any lobbying at the state that you are talking to us in advance, because there's very, very particular rules based on each specific state. All right, let's go to the next slide. So just like there's laws in the states, there's also laws federally. So this is what I and TAA have to live up to at the federal level. So we have very strict definitions on what lobbying is and reporting requirements for that. I am a registered lobbyist personally. TAA also is registered as an entity that lobbies. So TAA files quarterly disclosure reports. And as we file those reports, we list what issue areas we're lobbying on. We list specific bills if we have them, or topical areas that we cover, and who we're lobbying on those issues, whether it's the House, the Senate, administration, and even in the administration, we get pretty specific. It's Health and Human Services or CDC, for example. We have to list those as well. In addition to these quarterly disclosure reports that we do, we also file contribution reports. And these are reports that say we haven't given money to any members of Congress, we haven't bought gifts or anything else for staff, or broken any of the gift laws that exist in statute for members of Congress or their staff. And in addition to TAA filing a contribution report, I also personally have to file a contribution report for myself as to if I give any political donations over $200 myself to a candidate, and that I also personally have followed all the contribution reports. From a disclosure perspective, the quarterly report, civil penalties, maybe some criminal are in play. The contribution report definitely involves criminal penalties if you have broken any of the disclosure, contribution, or gift laws that are in play. So these are very important for us to follow, very important for us to know. And as long as you're coming for Advocacy Day or when I know, we are fine and not a problem. But I just wanted to make sure that you are aware of those as well, because these are very important. So on to our final slide. We need you, and that is the important part. We need you, and I want to work with all of you guys. So what is important? How do we need you? First, I kind of mentioned this in the previous slides, but relationship building with your senators and members of Congress in your state. And as chapter leaders, it's important for you and your board to engage in that, but also involve your chapters. It's also a service you're providing to them to put these meetings together and give them opportunities to meet their members of Congress, or have them do it if they're really interested. But the more you guys engage in this outreach, the better for everyone in your state and district. Also, what we need is assessing any political connections of your chapter leaders or your members. Does anyone personally know a member of Congress? Are they a neighbor? Are they a friend? They go to church with them. Knowing those things, are they big donors that happen to know them very well from that? The more we understand about political connections we have. Even more important is if anybody knows of a member of Congress, a senator, or their staff who has a family member with Tourette's syndrome. That is even more important for us to know. Also, email outreach. You guys have been, especially some of our chapters, have been very responsive to those email outreach on appropriations, as I mentioned, and the senator staff were very grateful for that and appreciative and want us to continue that. So that will be an important thing for us to work on together. And point 4 kind of goes to point 1 as well, which is coordinating meetings in the state and in the district with your folks, especially after we get these new guys in January, and girls who are going to come serve us in Washington. And also, state and local matters. The constituent voice is always listened to more closely. That's why it's so important for us to have you guys engaged as well, to really make it personal and make them understand that folks in their district and state will hold them accountable and want them to take care of them. But to that end, I hope you will pass on the information for National Advocacy Day to your chapters and support group members and encourage attendance. And I'd like to challenge all the state chapters that are not New York, beat New York's record of 55 attendees last year. So I really, really want you to push hard and try to see if you can beat that number. Also, send any information or intelligence or thoughts you have to me anytime. You've got my email, but share, even if it's maybe not pertinent, but probably is, and I might figure out an angle where it is. So please let me know your thoughts. If you hear of a bill or a regulation and you have questions, make sure you contact me. And literally, I mean it, email or call anytime. I think both Joe and Megan can tell you I do love talk, that is legitimate. It's an understatement that I love to talk. So feel free to call anytime and we can talk this through. And if this is something you're interested in, or maybe it's not your favorite thing to do, I am happy to work with you to actually help develop an outreach plan for your chapter. We can talk through who are the most important members in your state and where more emphasis should be given than not. So those are the conversations we can have, and I hope that you don't hesitate to reach out and let me help you with that. And another thought would be, if you have folks in your chapter, maybe politics isn't your favorite thing, but you have folks in your chapters or support groups who really love it, they can always be an advocacy volunteer, and we can bring them into the loop and develop this plan and utilize their passion to that as well. So just another idea. But with that, I want to leave time for questions. So I want to go ahead and end my presentation portion, and I think we can open it for questions, hopefully, Joe and Megan.
Yes, yep. So we have a couple great questions. I want to remind everybody that if you'd like to submit a question to be answered, to use the questions panel on the right-hand side of the screen. So we're just going to dive right in. So the first question here is for you, Diana. How can the state chapters help you more?
Well, I think I outlined some in that last slide, but that's a great question. Again, the more we talk and communicate, the better on the policy side. So I hope folks don't hesitate to reach out to me when they have questions. But certainly, when you're seeing emails from Joe or I asking for your help, please take it seriously and please help us out with those emails, even if you're busy. That would be fantastic. But we really hope, as I mentioned, to do things differently and take things to the next level. So, one thing you could definitely do is let's have a conversation about an outreach plan for your chapter in your state and see what you guys can do in the state to underscore what we're doing in Washington and really drive it home, especially as we have this new Congress in front of us.
Great. Another question that's come in here: what are the issues that you are contacted about most?
Right. So I think the issues that I contacted about most, I'm going to group into the area of that access to treatment and care category. So it's a lot of things in that category. It's a pretty big one. But in that one, I would include things like mental health parity, so coverage of mental health services at the same level of healthcare. Pre-existing conditions, that's obviously an issue for us and our community to care about and continue to focus on as we move forward. But the ones I hear about even more are those day-to-day ones I mentioned, the step therapy. So being told you can't take the drug you were prescribed, you need to take a different one. Or at the point it's prescribed, or non-medical switching, which is you've been taking a drug for 2 years and all of a sudden they tell you they don't cover it anymore. Or all of a sudden, yeah, they cover it, but you're going to have to pay a $150 deductible when you were paying $25 last month. Or these new co-pays that are having and coming into play with deductibles. And another one that might happen is if you're using rebates or coupons when you go to the counter at CVS, well, they're no longer maybe going to count those coupons towards your deductible. So that discount, you save it, but you're still going to end up paying it with deductibles. Those are some of the biggest ones I hear about. Oh, the other one I almost forgot, prior authorizations. That is a growing one for folks in our community. Because we're on generic drugs, you wouldn't think that it would be so common. That is when you go to CVS and they tell you that you need prior authorization before they can give it to you. So you have to go back to your doctor's office or call your doctor's office and get them to contact the insurance company. And it can do a few things. One, it can delay your ability to get it because now there's a process that has to be given. And unfortunately, when that happens, then not all patients fill the prescription always. So medical adherence is not as good. But those are probably the top ones I hear about. But again, my email is open, so if folks are experiencing other issues or have other things that are important, please, reach out and email me.
Great. And so another question we have in is, what are you doing in regards to policy for education and schools?
Excellent question. So education is an important area for us, and TA has an advisory board that works on that. And I think the spring briefing, as well as visits when I go to the Hill, we talk about the fact that school and getting through school is one of the hardest parts of someone's life that's going through Tourette syndrome and their, youth and teen years, that it can be a lot. Education is a big issue area and one that is important broadly, but especially as we look at an administration that is wanting to look at education maybe in a different way than it has in the past. So we work with the Consortium for Citizens with Disabilities that has an education task force and really digs into all these education aspects, whether it's laws or regulations that are happening. And we work with them to determine a best path forward on different laws and regulations. Not a lot has been done as far as education policy on Capitol Hill that has been moving for us to work on, but we did submit comments in the last year to the Department of Education. One was as they were looking at state and local funding, that they should assess and make sure, especially in rural areas, making sure that schools have the resources to manage IDEA Act, for students that might have disabilities or needs under 504s or IEPs, and to make sure that those schools get adequate consultants or resources to make sure they can provide that to the students. The second comment we submitted was on charter schools and looking at expanding charter schools, and we submitted a regulation that talked about the need to make sure that as they're expanding these schools, that they don't forget twice exceptional children. So children who have extremely high IQs or high IQs, above average, but aren't able to tap into that because of some of their comorbidities, Tourette syndrome, and other aspects as well. And not only did we submit them, but we submitted them in partnership with the OCD Foundation, so IOCDF, to work on that together. That was one of our new partnering areas, because they're just getting involved in advocacy. So those are some of the things we've done in education, but we continuously work on that and monitor that. And again, we work through several coalitions, but the Consortium for Citizens with Disabilities is one of the primary areas. And I obviously work very closely with our education specialists in TAA and the work that they do, and they keep me abreast of what they're hearing in the field on education as well.
That's great. So we have another question here. Doctors can play an important role with patients. How do you ensure that TAA policy is in line with the needs for TS doctors?
Right, that is a great point. And I think we do that in a few ways. One is we have a fantastic medical and scientific advisory boards. We have both of those at TAA, and they are fantastic. These are doctors that truly care about our issues and are leaders in that for Tourette syndrome and experts. So as I mentioned, we have created a advocacy work group of those committees for those that are interested in advocacy and want to work with me as I move forward on policies to make sure that the policies we're working on are in line with where the doctors will be. But in addition, I know that logo slide had a lot of small logos, and there was a lot of them on there. Some of the logos on there are the physician groups. So you can see in the bottom left corner is the American Academy of Pediatrics. You look over towards the right, you see the American Academy of Neurology. And we also have the American Psychiatric and Psychological Associations. I work in town a lot with the physician groups as well. So we're making sure we're keeping in touch with one another, and often we're even doing group letters together. And that evaluation and management issue that I talked about for physician reimbursement, we joined on to a letter with the Academy of the American Academy of Neurology, along with, I want to say it ended up being maybe 100 other groups, to really put our voices together and talk about why making sure physicians are reimbursed, especially for complex patients, is important. So we try to work with them whenever we can on issues in common, and certainly I also make them aware of our priorities. So they make sure the CDC Tourette syndrome, especially AAN, that the CDC Tourette syndrome program is on their list of important funding. And same thing with research at NINDS or NIMH, the National Institutes of Health. So we try to work together and do everything we can to make sure both communities are taken care of as we move forward.
That's great. We don't seem to have any more questions at the moment, so we'll just wait a moment to invite anybody else to submit more questions, and we'll wait just a second here.
Great. Don't be shy, guys.
Well, we've had a lot of great questions. So if other people have questions at any time, you can reach out to Joe or myself or Diana, anyone here at the TAA that can help you. So thank you all for joining us this evening for our chapter webinar series on public policy tonight.
Good night, everybody, and thanks again. And thank you, Diana.
Thank you. Thanks, everybody.